this is Honey.
This is Jeff, our honey bunny.
Clean as a whistle.
You want to head on into the exam room too? I'll let him know you're here.
Come on.
Dr. Aaron?
Yes.
Rocky the goat is in room 2.
We have a baby goat. Is it so cute, Julie?
Yes, it's adorable.
Goat with diarrhea. That's not as cute. Hi, Rocky. Hi. So tell me what's going on with Rocky.
I just got him last weekend.
All right.
However, his stool has been soft to
Okay.
liquidy.
How old is he?
11 weeks this week.
He seems very quiet.
He's always this quiet.
Okay. Has he had all his baby goat vaccinations?
He has.
Okay. How about the deworming?
I don't know about the deworming.
Okay.
Yeah.
All right. With young animals and animals new to the farm, we always worry about parasites, bacterial causes of diarrhea, viral causes of diarrhea. A little raspiness in his lungs, a little bit abnormal. We also got a little fever, so 104.2.
Okay.
So a little warm. Rocky just doesn't feel good today. He came in for diarrhea, but I think we have a little bit more than that going on. Was he the only goat you got at this time?
I got 4. None of the other ones have these symptoms, just him.
Okay.
Yeah.
And did you bring poop?
I do have poop.
We love bags of poop. Oh,
It's a little bit better than it has been.
Okay.
But I know it's not the consistency it should be.
they should look like little
Rabbit pellets.
rabbit turds, like candies. Well, this looks like a different kind of chocolate candy. We'll go ahead and get this run, see if we have a parasitic answer to why we have something going on. Oh, no. Holy moly. Hey, Val.
Yeah.
I think that we should show her this.
Okay, I can grab her. Dr. Aaron would like you to take a look at the fecal slide.
Oh, sure.
All these little tiny circles are all little coccidiosis. It's a really contagious parasite. And we are loaded.
When I seen the screen and I saw the coccidiosis, I was really worried. I'm absolutely concerned that it will affect my other goats.
This obviously is giving him loose stool. He's just not quite 100%, and I think we're maybe developing a little bit of pneumonia in those lungs. We've got a fever. But because he is so loaded, I feel like we need to probably treat everybody
I
because
was
they're all in the
going to
same.
ask you. I would rather treat everybody and just
Okay.
be safe. Yeah.
This is a danger to other goats because it's transmissible. It's fecal oral. Goats eat hay and grass off the ground right next to where they poop, so they can ingest that fecal material. And because he's so young and still developing, this can be life-threatening to Rocky if we don't treat him now. Rocky needs some antibiotics, he needs some coccidiosis treatment. We got a few things to do with Rocky. Now you eat that. What do you think? Yeah, you're a pretty cute baby. You got kind of a gross tummy problem. Gina's got her work cut out for her. She's got to give the rest of the pen the same medications that Rocky just got, and she needs to isolate Rocky just as a precaution. So I'm going to follow up with him soon, and hopefully everybody will be in the clear. I'm super glad that you brought him in
Yeah,
today.
me too. Thank
because
you.
he needed a parasite intervention. He's like, yeah, I know, but I'm cute enough to still get snuggles despite it.
All right, Archie, time to get your little probiotic. Tastes like peanut butter. You're gonna love it.
After you.
Hello.
Hi.
Hi, Julie.
Hi.
So you got Tuffy in there?
I do.
Oh, you're beautiful. How old is she?
She's about 10 years old.
Okay.
When I found her, she was just this itty-bitty little thing. Her nose and eyes were all mattered shut. We named her Tuffy because she is a tough little cat.
The name fits.
She lets you know where you stand with her.
What's the issue today?
So she's got a little bump on her nose. Showed up maybe 2-3 years ago. And in the last year, it's gotten bigger. One of my other cats hit her in the nose, and it got bigger. It had kind of changed colors, so it needs to be looked at. She just doesn't really like anybody messing with it.
So do you think it hurts?
I think so.
Yeah, she kind of moves her head away, doesn't she?
Yeah.
Does it hurt, Tuffy? The bump, I guess you could call it like a little pimple. This is somewhat unusual. I don't see this every day. This could be an abscess where that was like a puncture or a bite and there's just a little bit of pus in there. But it doesn't make sense that it's been there this long.
Yeah.
Val, do you mind grabbing her? And I'm gonna take a really good look and try to feel.
You can scratch me and not your mom, okay? You're all right.
It's pretty hard.
Yeah.
Boy, there's lots and lots of things running through my mind of what this could be. Potentially, there's a foreign body in there. Skin is kind of growing around and it's like fibrosed. Other options are, definitely cancer we have to keep in mind. Tuffy needs to go under anesthesia. We need to do a biopsy where I'm gonna take all those cells of this whole mass out, send them in and see what we got. Because we've got to know what this is. I'm pretty concerned about it. I hope it's nothing, but it might be something.
My greatest concern is that it could potentially be cancer. That would be devastating for me right now.
So we're gonna schedule Tuffy for a mass removal on the nose. There's a lot of things that could be going on here. There's only one way to find out. There she goes. She says, it's time to go home, Mom. All right,
All
Tuffy.
right.
Stay tough.
Minnie, you had a set of twins since I've last seen her, so how's that going?
Right. She is adjusting, but you can tell she doesn't like all the crying anymore now.
You don't like the sound of baby crying, Winnie? Well, me either.
Come on, Happy. Come on. I noticed that our 7-year-old little Chihuahua Happy was limping pretty darn bad this morning. Now we're gonna figure out what's up. Oh, poor guy. There is a lot of things that could have happened to Happy out at our place. He could have got stomped on by one of our horses, could have gotten a tangle with one of the cats, and he's had a cat bite abscess before. Hey, Val,
Yeah.
I need some help with Happy. Do you mind?
Okay.
Poor little Happy, he's limping on a right hind leg really bad.
Poor Happy.
So we need to take some pictures.
Okay.
We got to take an x-ray to rule out a fracture or a dislocation. Both of those scenarios would be really tough on a tiny dog like Happy. It appears that we don't have a fracture, thank goodness.
Good.
Nothing's dislocated either.
Poor Happy.
He's not happy.
No.
He's not his normal happiness. The x-rays showed up negative, but Happy is definitely not out of the woods yet. So now we're gonna make sure there's not an abscess. We've just really got to get our hands on this leg and see what's going on. Look how he's just holding his leg up right there. He won't put it down at all.
No.
Well, if this is a cat bite abscess, usually they have a fever associated with it. We'll see if that matches up with what we got going on here. Sometimes after a cat bite, bacteria gets inside the wound and then the wound closes. And then the infection gets trapped inside and that leads to a pus-filled pocket or an abscess. The temperature is normal, 102.1. So it probably isn't a cat bite abscess, but we might be a little bit early in that. So let's just shave this area and see if we see anything. Okay. That kind of hurt. I don't see anything on the outside at all. So let's take a really good look on the inside of his leg. He doesn't like that. I tell you what, I don't think the horses stomped on him. I don't think he got in a fight. I think he just kind of has some soft tissue injury to his knee. His breed of Chihuahua also has patella problems. The patella is the kneecap. And when this kneecap gets a little too lax, can get out of the groove it's supposed to be in, then that's really painful for this little dog. He needs some anti-inflammatories and rest for 2 or 3 weeks. Hopefully that works. Happy needs rest and no play. Aaron is gonna love this. Don't worry.
He's pretty happy with his mom. Buddy, what'd you do, handsome?
Happy you get better.
I love him so much.
Laurel, I just got sent this text that's bad to be there any minute.
Oh, yikes.
Just be ready for anything. I've got Cole coming in with quite an emergency. Basically just threw his horse in the trailer and started down here to the clinic. This is Cole's dad's horse, Sweetheart. It's actually a brood mare. All I know is there's a big wound. It looks bad. Oh my goodness.
Easy, baby.
Oh, this just happened, didn't it? Not too long ago.
It couldn't have been too long. Sweetheart, she hit her head on the fence fighting with another horse by the feeder. I've never seen an injury that's this bad. My father's not available. He's actually out on the road trucking right now, and I knew it was very urgent. Everyone be careful.
Yeah, the skin is torn down like in a big flap. She's already got some nerve paralysis in her nose, see that? She's kind of got a little bit of a twist to her nose. It's torn through one of the main nerves that goes down to the nostrils and the mouth of the horse. There's lots of dangers here. If we don't get this treated, infection could set in, then sepsis. This is absolutely a life or death situation. Now, what could complicate things here for some of the meds I need to use is if she's pregnant or not.
She's not been pregged, but she's supposed to be.
Sweetheart, she's a broodmare, and her job is to have babies. So I really want to preg check her and see if there's a baby inside, because that really gives me an idea of what pain medications I can use on her. It just kind of tells me the whole story here with this horse. So Cole, she's not pregnant, which is really a blessing in disguise here. We don't have to worry about her losing a foal from all this stress, which would just be terrible. So now I can give her all the pain medication, all the antibiotics that I need to just to fix her up.
Okay. Easy, girl.
This is some pain medication and a tranquilizer all in one. First things first, I gotta at least palpate this and see if it's down to the bone.
Yep.
Whenever I've got a wound that's a very deep wound, I've gotta investigate that. I've gotta make sure there's no foreign objects that were left and really go see how deep this is. Cole, look at this. My fingers are in this far, which is about 3 inches deep. I mean, we are just a couple inches from her jugular vein. These are all ligaments, tendons, fascia, and they're just torn to shreds.
You poor girl.
We're just gonna start putting her back together, one layer at a time. She's a lucky horse so far. I'm always nervous whenever it comes to sewing up a wound like this. Sometimes there's a piece of skin that isn't there anymore and I can't get everything brought back together. It's all going through my mind right now and my mind's racing. Get it nice and clean?
Yep.
So I gotta start from the inside out here. I gotta take all those muscles, I gotta get them sewn back into place. This facial nerve that was severed right in half, I've gotta actually tuck it back underneath the muscle and get it back at least near the other half of the nerve so that this can try to grow back together. Then I gotta start on the skin and do a 3-flap closure. This is tricky. This is something that human doctors do all the time. I rarely do this. There's a lot of pieces to this puzzle. This needs to get pulled forward. Hang in there. She still has this facial nerve that's intact. That's good.
You just cover that up with the muscle.
Yep. We're gonna sew that back up here and hopefully give it a chance to regenerate and grow to the other side of it. Nerves are amazing tissues. Those electrical pulses can find each other and nerves can heal back together. This is about a 50-50 chance, but we're gonna hope she can have a normal nose and chew normally again. I'm done with everything on the inside. Now it's time to sew up the skin. All right, let's get our drain laid in there. There's gonna be a lot of swelling and a lot of fluids that are gonna build up underneath the skin. So this drain that we're gonna put in is gonna allow that to all get out of the body. She felt that a little bit.
Sorry, girl.
Good. Nerve still intact there. All right, she's all sewed up.
Looks like a horse head again.
Exactly. I'm very relieved that Sweetheart is doing as well as she is. When we get Sweetheart home, I'm definitely confident between me and my father, we can look over her and give her the care she needs. Good girl.
Everything went very, very well. I gave her a tetanus booster, some antibiotics. Now it's time to just let her body heal up, and I'll see her again soon.
Thank you, I appreciate it. Appreciate getting us in right away. And
Yeah, this was an emergency for sure. Good girl, I know.
Morning. Hi.
We have Tuffy back in today, who is a lovely old lady kitty that has a lump that needs to be removed off her nose and sent out for testing in case it's cancerous.
Oh, you look like a unicorn.
Ben's had one heck of a morning, so I'm happy I get to take this case off his hands.
Oh, hey, look, we're in. Oh, no.
Hang with me, Tuffy. I think Tuffy is named Tuffy for a reason. She can be a little tough. She's a little grumpy, feel like the older I get, the tougher I get to deal with too. Maybe that'll be my new nickname. This lump could be really scary. It could be a cancer, so good reason to get this off today. So we're going to just remove as wide a margin as we can around this little lump and take this off and put some stitches in. But just because it's a small lump does not mean it's a small problem. Oh, there we go. You're gonna have a pig nose now. Little pig nose cat. All right, well, let's get her finished and then we'll get that ready to send off to the lab. The biopsy is hopefully going to give us an answer. It's going to identify what this lump is. Good job, little baby girl. At home, Julie just needs to let Tuffy really rest and relax, and then making sure her pain is adequately taken care of. As soon as we get the lab results, we'll be able to take those stitches out and let Julie know. Oh, don't be so grumpy.
Sounds like she's rolling in. One of my favorite patients out there, Big Jake, is coming in, and Big Jake has a problem with limping. Hey, big guy, we're gonna take care of you. He belongs to Jerry Stewart, one of my best clients. He's sending Abby in, one of his ranch hands, because this is an emergency. What'd you do, Big Jake, huh?
Jake is a total sweetheart. He's definitely a favorite on the farm.
Hey, bud. When we go out and check Jerry's cows, Big Jake is the one that I ride. Look at you, you don't even want to move your feet. That looks pretty swollen and puffy. Slick out there right now. He could have slid and even broken a bone down in that foot. Do you want to just take him in a little bit of a circle there for me, just to make sure there's no other limbs that are bothering him? He doesn't even want to turn on that, see that?
Yeah.
He's trying to keep all the weight off of that leg if he can. Something's definitely wrong in this front left leg. I've got some suspicions whenever it comes to a very suddenly lame horse. Number one, abscess. And if there's a fracture, that would also show up as swelling, as pain, all these things that Big Jake is showing us. All right, Big Jake, give it to me. One of the most important tools I have in my bag of tricks is the hoof tester. See that? He doesn't like that very much. Its ability to create many pounds of pressure in one spot really tells me where it hurts. He is very painful on the inside of the hoof. That could be like a sprain or a fracture.
Yeah.
A horse's most vital organ, it's their feet. If you can fix a horse's foot, you can save their life. Fractures would be the worst thing about this whole deal. So if we find one, that could be orthopedic surgery. So let's go ahead and take an x-ray of this. I pray that's not what's wrong with you. It's okay. One of the most important things to do when we x-ray a horse's hoof is to pack it with clay. This is just some modeling clay that you buy at the store. It'll fill any air pockets in the hoof. So if anything does show up on the x-ray, we know it's a fracture, not air. Okay, Abby, I think we have our answer here. Look at the black going up along there versus this side. A lot of times that shadowing is some fluid where it shouldn't be.
I mean, he's that kind of painful. I feel like if it was a big fracture that was this much, we'd really see some radiographic change.
Yeah. The x-ray confirms that there's no fracture and we've got an abscess. He definitely could have stepped on a foreign body like a nail or something like that.
Yeah.
So now it's time to put a little bit of pressure on it and see if I can squeeze this abscess out. Oh man, he does not like that right there. Oh, I got it, Abby.
Oh, did it pop?
Yes, look at this. See this fluid that's coming out right there, that hole?
Oh, yeah.
It's like a river. Man, this makes me happy. Just brown pus. I found out really what's causing Jake is pain. And when I can do that for a horse and make it better in an instant, it makes me feel so good. These Epsom salts, they're gonna draw out whatever's left in there. 10 minutes in the bucket there, Big Jake. It's gonna help pull all this pus right out of that hole. Now let's pack that with iodine. Let it do its thing. And you know what its thing is? Killing bacteria. Duct tape, vet wrap, a little bit of iodine, and you're good to go. When it's wet and moist outside, I don't want that moisture to get into my hoof, so I can create a physical barrier by using duct tape. Now that we've got it drained, the pain's gonna go away quickly, and he's gonna feel better in a few days. I really do think that Big Jake's prognosis is excellent, but He's my buddy, so I got to go check in on him in a couple weeks and just make sure he's okay.
You want that? You want it from Dad?
He's very particular about his treats.
He knows we're trying to bribe him. He's pretty smart.
What do you think, little guy? We recently noticed our dog Happy was limping, so we brought him into the clinic for some x-rays. Happy has a luxating patella, which is very common in small breeds. It's basically his kneecap shifting out of alignment. So today, I think I have something that he's gonna love. Good old laser treatment. I know you don't feel better yet, but this is gonna help. This laser therapy is gonna speed up Happy's healing. It'll give him more blood flow and energy to those cells around the area.
Happy.
Oh, that tail's going.
You want a cookie?
He's being a good boy for this treatment.
How's his leg doing?
Well, that luxating patella
Yeah.
has been bothering him, but this is helping. Most luxating patella cases don't require surgery. And Happy's an older dog. He's 7 years old now, so we want to avoid that. In human years, Happy is about our age, honey. He needs to take up golf.
Yeah. Good job, Happy.
You hear that? Good job.
Oh, don't be scared.
Today we have Gina and Eric and their little goat Rocky back in the clinic to recheck some parasite issues he had.
Oh, he's having a little...
Doesn't have diarrhea anymore. I brought Eric because Rocky is much heavier and he's gotten very stinky these days.
I get the sneaky job. Great.
Hey, Rocky. The last time Rocky was here, he had some pneumonia, some difficulty breathing, and the coccidiosis. So we're gonna check him out and make sure all these issues have resolved. Well, since his last visit, how has he been doing?
He's been doing great. Him and the other goats, we've been keeping an eye on him. Everyone's doing well. While he was getting treatment, we separated him and kept him isolated from each other. He looks a lot healthier today.
At first glance, Rocky looks great. He's grown a ton, he's shaggy, kind of stinky, but that's what boy goats are supposed to be smelling like.
You so darn cute.
He is
Are you
sweet.
into mischief all the time?
Okay. Well, we're at 102.8 today with a little excitement. You know, that's very, very normal. Let's take a listen to your lungs, big guy. Sounds nice and clear. No raspy crunchies. Good boy. So that's wonderful. But I think the last thing we need to do is check the fecal to make sure everything looks negative. It looks so much better. It's formed, it's not runny and full of diarrhea. Rocky's given us plenty of fecal sample, so we're gonna make sure he doesn't have any parasites anymore. I'm not seeing any parasites at all. In terms of poop, this is a great poop. So great news, the fecal was completely negative.
Oh, great.
So no parasites, no coccidiosis, no worms.
It feels great that Rocky is in the clear, and I feel like all my goats all have a clean bill of health.
Oh, I think there might be a little bit of a bromance here. I'm not sure, but it's how it usually goes.
Yeah.
We just had a gentleman named Sean call. He noticed that his little dog Chico was running around with a rat bait canister in his mouth. Hey, Val,
Yeah.
this is the doggy that got into the rat bait.
We were insulating inside of a barn that we built. Just noticed Chico getting into some rat bait.
I know.
It's all right, buddy.
When I seen it, it was chewed on. And then I decided to hop in the truck and come in. I want to get him the help he needs right away, if it is even possible to save him.
Okay, I know. Did you eat the bait?
However much poison it takes to do damage is usually scaled to the size of the pet. We're gonna give him an injection of medication that will reduce vomiting and try to clear out his tummy. The longer that any poison stays in the stomach means that it's starting to move through the GI tract, starting to be absorbed into the bloodstream. A smaller dog doesn't have to eat as much to do a lot of damage, or potentially even cause death. You want him and I will go get Dad? Okay. Sean just saw Chico running around with this rat bait package in his mouth. He's not sure if he ate any or not, but to be on the safe side, we're going to induce vomiting and get whatever's in that stomach out. Oh, there we go. If Chico ate rat bait, generally we'll see some green coloring. So we're gonna go through all of the vomit to see what Chico has ingested. I'm looking for any bits of rat bait. So far, I'm not seeing anything. It mostly looks like dog food and like he ate some grass. The good news is I'm not seeing anything that looks green or gross. Luckily, we're not seeing any evidence of the rat bait in his vomit, which hopefully means that he didn't consume any in the first place. We'll give him just a few more minutes, make sure everything's really out. We should be near the end. We're gonna get some nice sub-Q fluids, get him nice and hydrated. All right, ready, Val? Oh, you're okay. So this is the injection that's gonna help him feel not nauseous. There you go, that's a little stingy. Think about flowers and unicorns. Now that we've completely emptied Chico's stomach, we're gonna go ahead and actually give him some activated charcoal. In case he happened to eat something that we couldn't get out or that's already started absorbing, that activated charcoal is gonna bind it all up and hopefully not let him absorb any more of any potential toxin. Things to watch for, any additional vomiting. If he just doesn't seem to feel good over the next 24 to 48 hours, he's not eating, not drinking, I would say by dinner time you can offer him a small amount of food. Chico seems calmer, and I'm comfortable he vomited whatever was sitting in his stomach. But I'll definitely want to see him again.
Oh, he says hi, Dad.
Today I'm out here at Jerry Stewart's, and I'm gonna meet Abby to take a look at Big Jake, my favorite horse in the whole wide world. Morning, Abby.
Hi.
Abby brought Jake to me because he was limping pretty darn bad on a left front leg. And once we found this was an abscess, really it was a pretty simple fix. We drained it. Oh, I got it, Abby.
Oh, did it pop?
Yes. We put a padded bandage on there and we put him on some antibiotics. And it's been a few weeks and I just want to make sure that Big Jake is sound. How is our patient doing?
He's doing awesome.
Good. Well, I tell you what, I want to put the hoof tester back on there.
Okay.
And make sure that that really, really painful abscess is all the way gone.
Yeah. Jake started out very sore, obviously, from the treatment and everything, but his mood has improved.
Well, that's great.
Just overall, huge difference.
He looks happy, doesn't he?
Oh, yes.
All right, let's take a feel. This was the area right here. I'm squeezing as hard as I possibly can. Urgh. And he doesn't wince. No pain at all.
Good job.
Tell you what, the only proof in the pudding here would be to take him down that road and back.
All right.
I know Big Jake like the back of my hand. I've ridden him a whole bunch. And if he can handle me without any lameness, then I know he can handle anybody that gets on him. Let's go.
How's he feel?
He's smooth as he ever was.
Good.
This is great. I really can't feel any lameness, so I'm happy that he's happy.
He looks good.
Jake, are you happy? Huh? Jerry and Abby, of course, did a wonderful job taking care of Big Jake. Thank you, Abby.
Oh, thank you.
Yep. Thank you, Big Jake. That was fun. You know that? There's some horses that you kind of just form a bond with in your life, and Big Jake, he's just one of those that you love. There's nothing better. I'm glad I'm a horse doctor. Bye, Jake.
Hello.
Julie is back in today with Tuffy. We removed a little tumor on her nose a couple weeks ago. Hi. How are you?
I'm good. How are you? Hi, Val.
Good. How's Tuffy? Tuffy in a happy mood?
Since Tuffy's surgery, she took a couple days of just kind of quiet and wanting to be left alone, but since then she has become feisty and not letting anything push her around.
We did get the histopathology back, and it came back as a tumor of her erector pili muscle, so the muscle that helps make her hair stand on end. Cats have muscles that connect to the hair follicles. They're called the erector pili muscles. When a cat gets stressed or scared, the muscles cause the fur to actually rise. In people, it's called goosebumps. The great news, we got it all, and it's not likely to spread or regrow or come back. But we'll just kind of keep a close eye.
I'm glad it's nothing serious and I don't have to worry about cancer.
Sophia, I can't get your stitches out when your head is buried in the blankie. Oh, I know, you're being a really good girl.
When Tough gets home, I'll probably let her do whatever she wants to do, because she will anyway.
So I think she's in a good spot. Now she just needs to continue to recover, and I think she's going to be a pretty happy cat here.
Awesome.
Jim, what's going on?
We have a broken leg, I believe.
Oh boy.
It looks like he got hit by a car.
Who is it?
Yeah, Keno.
Keno, okay. We go way back with Keno as a patient. He really is a life-saving dog here at the clinic. Keno, you ready to go save a life? He saved Butterball's life by offering his blood for a blood transfusion.
Blood is running. Okay.
I can't say enough about this dog. Keno's family lives right on a major road in town. You can see the road rash from here.
Yeah.
Ouch. Unfortunately, dogs do get hit by cars. Oh yeah, it's broke. This is urgent. And it's usually not a very good situation. If the dog can even survive the initial impact, we're talking about broken bones, internal bleeding, and terrible, terrible injuries. We're gonna go right back to x-ray. Okay, Jimmy, right now what I'm seeing is there's a whole bunch of swelling. I'm gonna take a bunch of x-rays and see what we can do here.
Okay.
I'll give you a call as soon as I know something, okay? Poor Keno's in a lot of distress, and some owners can handle every single step in an emergency. But Jimmy just couldn't bear to see his Keno like this. He had to leave. Oh no, both legs are affected. The tib fib is definitely fractured, and looks like the hip in the other leg is dislocated, you guys. This is a big problem.
That's not good.
Poor dog. I'm sure you've heard Keno's here.
Yep.
It's serious.
I've treated Keno since he was a little puppy.
No, who's my favorite? His tail's now broken.
Tail works, that's good.
We've been through a lot with him. He's part of our family, so I don't want him to suffer.
Right now, we have a dislocated hip, a broken tib fib, and pelvis.
This could be an open fracture real easy.
I know. You and I are both experienced enough to know this can go south in...
Like a second.
Yeah. He walks wrong and bones are poking through the skin. And I also don't want to put him through a ton of pain if he's never going to make it.
I think it's worth a conversation.
These are always the hardest phone calls we ever have to make. But we never, ever want to see an animal suffer if it doesn't have to. Unfortunately, what's right for Keno may not be very easy for Jimmy to hear.
Ben.
Okay, Jimmy, I've got a few answers here for you.
Okay.
So right now, he can't stand up on his hind end.
Sure.
Even best case scenario,
Yeah.
I don't know if we're gonna win here. I just
Yeah.
don't. So
Okay.
I'm just gonna throw you options here.
Okay.
I do think the tib fib fracture, if we gave it 5 or 6 weeks in a cast, I do think that would heal on its own. I do.
Sure.
But it's getting him that far without big complications. So if that bone ends up becoming an open fracture to the world, that means infection is likely to come.
Yeah.
The other thing is we've got to get that hip pushed back into place, and it has about a 50-50 chance of ever staying in by itself.
Sure.
The injuries that Keno suffered are devastating. He has a broken pelvis. He has 2 dislocated hips. He has a compound fracture in one leg. He has internal bleeding. Keno's never going to get back to his normal self.
Obviously, we love him, but I think at this point we probably put him down.
Well, I'm sorry, Jimmy. He's looking at me right now, and it's almost like he can understand.
Oh.
I'm going to go ahead and put him down now, Jimmy. I'm so sorry.
Yep.
He decided that it's going to be too much to go through. I'm sorry, big guy. We really feel like Keno's chances are very slim of any recovery. And to put him through all of this, it doesn't seem humane. And Jimmy's family agrees with us here. Everybody handles tragedy differently. And we know how much Jimmy loves Kino. And it's a little too much for Jimmy to see Kino like this. So he trusts us to do the right thing. Sometimes you have to let him go. Oh, I just got off the phone with Jimmy.
Yeah.
He's really worried that he's gonna go through so much pain.
Yeah.
They're gonna say goodbye.
Mm-hmm. Hi, buddy. I'm sorry.
This is never easy, but my job as Kino's veterinarian is to provide him love and compassion. And if the decision is made that he needs to go to doggy heaven, then I'm gonna do that in the best way I can. That's what I signed up for in becoming a veterinarian.
Okay, honey. I'm gonna go ahead and do it, okay? Thank you for being a good boy.
I feel really fortunate to hold Kino's paw and give him his kisses and provide him some relief in his final moments.
He's gone.
I really have. I've taken care of that puppy since he was just a little ball of red.
Kino's lived an exceptional life. He's a lucky dog to have the family that he had. And I do think that Kino is living on in Butterball, whose life he saved.
Thank God for Kino.
We will love Kino forever here. He's gonna live on. Hey, boys.
Hi, guys.
What's up? It's like a MASH unit in here. Today was extremely sad for us, but it's days like today that also make us very grateful that we get to come home to this family.
Even if it is a couple of teenage boys who would rather be on their phone than see their parents.
Chase hurt his ankle playing basketball, jumped up, sprained it up high. Charlie hurt his back lifting some weights.
The only one around here who isn't hurting is Happy, who's finally better because we did laser treatments on his bad knee. Let me see that ankle, Chase.
Oh my gosh. Chase, we may have to amputate.
Do it now, I can't feel it.
He might have got his ankles from me, but Charlie got his back from you.
Thanks, Pops.
Yeah. How you feeling, big guy?
Not too bad.
I see you got the heating pad on.
Yep.
We got little Happy walking again.
You got him better. Happy is definitely feeling like Happy again.
Hey, buddy.
He feels 100% better.
Oh, come here. He's playing keep away with his toy. Bye, Happy.
I'll never forget this one. This was quite a wound.
Mm-hmm.
Today, Laurel and I stopped by Cole's horse barn. Cole long haul trucks for a living, so he's gone right now, but he wanted me to stop by and take a look at Sweetheart. That's the mare that had the terrible face wound. Oh my goodness.
Sweetheart, she hit her head on the fence fighting with another horse by the feeder.
I've seen these kind of wounds before. They're so catastrophic. I'm really nervous. If this didn't heal properly, Sweetheart's life is in danger. Bacterial infection could result if the skin is compromised, and that could cause severe illness in this horse. Oh, wow. Oh my gosh. It's healing very well.
It looks awesome.
I'm seeing really, really good things. Some of the stitches, she's actually already itched out. Some of them are still there. There's a little piece of scab. This is how this is supposed to happen. I'm beyond excited. Remember that nerve that was going right across here that was severed in half? It must be starting to heal.
Yeah, it
Look
looks
at that.
like she can kind of control her nose right here.
That nerve is starting to fuse back together. She's getting some feeling in the lip and the nostril. It looks great. It's itchy, it's scabby, but you know what? It's healing. Look at that. I'm gonna go ahead and cut a few of these stitches out of here. There's one.
Good girl.
Good girl, that's gotta feel better. You know how
Good
itchy
girl.
these have gotta be, my goodness. Look at that big scab.
I think she'll be glad to have that one gone.
I think so too. Good girl, I know. Yes, yes. Whenever a horse is licking and chewing, that means they're happy. She says, "Thank you very much. Please, itch more." This is better than I ever could have imagined at this stage. I know there's just a little bit of a hole at the top, but it's healing over. It's healing from the inside out. There's no drainage anymore.
You look great.
You do. Good girl. This is awesome. You ready to go see your buddies again? The stitches were just part of the healing. This one goes to Sweetheart. She did it all on her own.
All right.
Let the rodeo start. This should be fun.
I think once I take this halter off, we're not going to be able to catch her again for a while.
Have fun,
Ready?
girl.
Go play.
Go run.
See you later, sweetheart.
It's still a little bit early to tell if she's gonna have a total 100% recovery. The nerve controls the nose and some of her lip, but you know what? She's gonna be able to eat, have babies, and do her job. This is great. I think she's pretty glad to be in here, don't you?
I think so.
Laurel, fist bump. Good job. Let's get out of here.
Next thing you know, you're gonna be taking baths by yourself.
Hey, Julie.
Hi, Sean.
Chico is back here with us today after he may or may not have eaten some rat poison. If he did eat some, we think we caught it in time. But even just trace amounts could leave long-term effects with a dog this small.
Looking for any bits of rat bait. So far, I'm not seeing anything. It mostly looks like dog food and like he ate some grass.
So we just want to make sure we have an all-around healthy Chico here with us today. Well, let's go ahead and go up on the table. You know, we have one that kind of looks like you. You kind of look like our Happy. How's things been going at home?
Good, good. It's been
Good.
healthy, active,
Good.
jumping around.
All right, I'm gonna just quick listen to his heart. Sounds really good. And let's check out your color. That is a good color to see. Pink, not white.
Okay.
Yeah, we don't want pale, we want pink. And he's got a nice capillary refill time. Everything looks great. It appears that we're not gonna have any long-lasting problems.
Wonderful. From here on out, when I go to work, Chico will go with us, as long as it's safe. He's pretty happy. Being on a construction site, I'm thinking about getting him a hard hat.
You're a good dog, you know that? Yeah.
We are on our way to the Why Not School to give blood today and help all the people in our community. And by we, I mean Val and I. This is our first time ever giving blood. We're gonna go do some good in the world. What's great about today is that we're not only helping other people, but we're also celebrating Kino, who sadly just crossed the Rainbow Bridge. Kino was a regular blood donor who saved the lives of other dogs. So today, Kino, this is for you. I get the driver's seat?
You do.
Okay.
All right. You can release that squeeze now, and I'll release this tourniquet.
Easy peasy.
I don't like blood. I'm fine with pet's blood, but human side, it's a little different. But I'm reminding myself that Kino was such a brave boy. I'm gonna do my best, Kino, and try to be brave too.
You did good, Val.
Thanks. Not too bad of a poke.
This is the most relaxing thing I've done in the last 2 weeks. I'm not sure about you.
Yeah.
The snacks? The free snacks were awesome. But seriously, I'm grateful to be able to give back to the community and hopefully save some lives.
All right, you're all done.
Perfect.
And most of all, this was a great way to keep Kino's spirit alive. He was a great dog, and we love him and miss him.
Thank you so much.
Thank you.
Yep.